Go.
Good morning, guys. My name is Ariva Smith, and I will be doing my presentation on multiple sclerosis. Multiple sclerosis is a cell communication disorder, and in the simplest terms you can put cell communication, it's how cells communicate. It can be broken down into two different sections of communicating: long distance signaling, which is signaling all throughout your body really, and local signaling is cells right next to each other. Multiple sclerosis, which is often referred to as MS, is an autoimmune deficiency where your immune system will mistakenly attack the myelin sheath surrounding your nerve cells. In this you can see your when signal starts in your nerve cell, it starts and it travels down your nerve cell and reaches the axon where it's sent out. And your myelin sheath is just like a protective layer around your nerve cell, whereas with someone with multiple sclerosis, this myelin sheath is kind of like destroyed or damaged, where it may not be this bad, it can be kind of varied in your damage to your myelin sheath, but the signal, it either cannot reach your axons where it cannot send and to other cells, or when it does get through, it's jumbled, it's not the correct signal, it's not right, and so it's sent out wrong, even if it's even been able to send out at all. There are three different stages of multiple sclerosis, the first being relapse remitting. This is the most common diagnosis of multiple sclerosis, which is about 85% of people diagnosed with MS are diagnosed with relapse remitting. In relapse remitting, you go through a period of where you have a relapse, which is often kind of something you associate with cancer. When someone relapses with cancer, where their symptoms get really bad and they're progressing and getting worse, well then they'll go through a stage of remitting, which is where their symptoms kind of get better and they they get better and they, but then eventually, kind of recovery period, eventually they go through and they relapse again where their symptoms get worse. Whereas in relapse remitting, your symptoms don't necessarily get worse in between relapses, but they get worse every relapse. Whereas your first relapse, your symptoms may not be bad and you remit, whereas your next relapse, your symptoms get worse. The next stage is kind of the second step to relapse remitting, which is secondary primary. Most people are diagnosed with this about 20 years after they're diagnosed with relapse remitting. You can only be diagnosed with secondary primary if you've had relapse remitting before. This is when your disease progresses into where you no longer have those remitting periods, or in relapsing, symptoms just progressively get worse, and you don't ever, where you can have where your symptoms are kind of stable. They're not getting worse, they're not getting better, but you still do have symptoms. The last step or stage of multiple sclerosis is primary progressive. This one is kind of separate from the other two. This one is when you're first diagnosed with multiple sclerosis, your symptoms just are progressing and you never had the relapse remitting. You just, as soon as you were diagnosed, you had your symptoms progressed. This is probably among the rarer of the diagnoses for multiple sclerosis, where only about 10 to 15 people diagnosed with multiple sclerosis are diagnosed with primary progressive. In cell communicating, there are three steps. Your response, which is a cell receiving your signal, transduction, where it reads that signal, and response, where it answers that signal. Multiple sclerosis is a failure in kind of the transduction pathway, which then leads to failure in response, because if your cell can't read the signal, it can't respond to the signal. In multiple sclerosis, your cell has this overproduction, whereas TEA had overproduction of T cells. In multiple sclerosis, you have an overproduction of B cells. So when your white blood cells or your T cells come and read the myelin sheath of your nerve cell, it sees these overproduction of B cells and it thinks, I have to get rid of that. So it then activates the NFKB pathway, which releases the microglias, which these are what attacks your myelin sheath and destroy it and stop your cell from being able to communicate with others. A gene that they found in most of multiple sclerosis patients is the HLA-DRB1 gene, which is in the short arm of chromosome 6, and it's just kind of mutated wrong, and it's something that they've seen has been effect on multiple sclerosis patients. Multiple sclerosis causes lesions. These, when your cells are damaged, they can't really kind of go anywhere, and so they create these lesions on your brain. And this is what most people see and this is what causes all your symptoms, because if you have lesions on your brain at different parts of the brain, it obviously affects different parts of your body. This is how they diagnose most MS patients, with an MRI on the lesions. Or you also can get a spinal tap, which is when they take a needle and they go into your spinal cord and remove spinal fluid, and they can test it. And where you see where in a normal spinal tap you see, and where with MS you see irregularities in your spinal tap. Results. Some of these symptoms of multiple sclerosis kind of vary because lesions can occur on different parts of your brain, which cause different symptoms. But most ones would be poor coordination, vision loss. You have weakness in your muscles. Muscles can spasm. Bowel movements, bowel problems, fatigue, pain, difficulty swallowing, numbing and tingling all over your body. Speech impediments and stiffness can be a symptom of multiple sclerosis. People who are multiple sclerosis is mostly diagnosed in women, although men can be diagnosed with it, but mostly it's in women, and they're between the ages of 20 and 40. Probably about more than half of the people diagnosed with multiple sclerosis, women, are double the amount of men. Some environmental causes contributes to multiple sclerosis. If you've had an exposure to the Epstein-Barr virus, you have more susceptibility to multiple sclerosis. Anyone with low vitamin D levels, vitamin D is kind of a big portion of your health, and any low vitamin D levels can contribute to really any disease, but it does contribute to multiple sclerosis. Smoking and obesity in childhood can also be be some causes to multiple sclerosis. And where they found that if you live further away from the equator, which means colder weather, it can kind of have an effect on your symptoms. As where people with multiple sclerosis, something I found is that if it gets cold, they kind of won't go out because it doesn't make them feel all that great, and so they'll just kind of stay inside when it gets colder weather. Unfortunately, there is no cure to MS because researchers don't really know the exact cause to it. They don't know why your body produces too many B cells, but there is multiple ways to treat your symptoms, such as injections, infusions, or medications and therapies. Some of these treatments, corticosteroids are medications that just treat the inflammations of your symptoms and kind of subside the inflammation. Even though it may have a side effect, these side effects are kind of better than having to live with the symptoms of multiple sclerosis. You can also do a plasma exchange where it removes some of the plasma and put more protein into your body through a plasma exchange. Some ways they'll treat more specifically to multiple sclerosis is a treatment called Type 307, which is where it's a treatment that is promoting your myelin sheath to regrow. And it's just supposed to, if you don't have a way to reprotect your cells so it can continue to communicate properly, they don't really know if it's going to have too much an effect because your cell is already damaged, and so they don't know how much this growth is going to help, but they're testing it and furthering more. Obviously, putting more vitamin D into your body is always going to make you healthier, but a B cell therapy that they've tested is a treatment that depletes your B cells, because if you have an overproduction of B cells, and that's the reason your T cells are attacking your myelin sheath, if you can deplete those numbers, then you are able to, your body won't attack your myelin sheath, saving your nerve cells.